Parkinson disease. First, we see the definition. It is a progressive neurological disorder which is characterized by muscular rigidity, tremors, and hypokinesia. So, what is mean by muscular rigidity means stiffness. So, normally muscles it is in relaxed state, but in case of Parkinson, you'll be having muscular rigidity, tremors. Tremor is nothing but repeated or jerky movements of the body. Hypokinesia. Hypokinesia means kinetic means movement, so reduced movement of the body. So this is the primary characteristics of the Parkinson patients. So you'll be having secondary manifestation which is associated with Parkinson disease. First one is gait. So in secondary manifestation, you are having the first thing is gait. Gait is nothing but the pattern of walking. So there is a changes in the walking pattern and defective posture. So unable to maintain the posture, normal posture. Third is dementia. Dementia, unable to recall the dementia, loss of memory. And the fourth one is saloria. Saloria is nothing but increased in salivary secretion. So it is a progressive neurological disorder which is characterized by muscular rigidity followed by tremors and hypokinesia. These are the primary manifestation. Or the simple definition you can write related to the neurotransmitter is it is the loss of pigmented dopaminergic neurons. Okay, so the neurotransmitter here comes to play. What is the neurotransmitter which is involved? Dopamine. So dopamine is the neurotransmitter. It is excitatory neurotransmitter. Okay, so agitation, everything it is related to the dopamine. So dopamine level it is getting depleted in the substantia nigra. Same characteristics, primary characteristic which is muscular rigidity, tremors and hypokinesia. Mechanism of action of anti-Parkinson drugs. So before going to the mechanism, first we will see about the dopaminergic neurohumoral transmission. So tyrosine. Tyrosine is the precursor of the dopamine. So active reuptake into the presynaptic nerve. So this is the presynaptic nerve or the neuron. Okay, so in the substantia nigra, it is this process is occurring. So tyrosine it enters into the nerves and it is converted to dopa. Then this dopa is converted into dopamine by dopa decarboxylase enzyme, and this is the neurotransmitter dopamine which is synthesized. Once it is synthesized, it is getting stored in the synaptic vesicles. So SV is nothing but synaptic vesicles. It is stored. Okay. So action potential generation, neurotransmitter, that is synthesis, storage and the release of neurotransmitter. So third step is the release of neurotransmitter. So exocytosis is the process by which from the synaptic vesicle it is getting released in the presynaptic neuron. So after this it is released or coming to the synaptic cleft. So this is the cleft. Okay, so it is getting released and it has to act on post synaptic neuron or the receptor which is present in the postsynaptic nerves. Okay, so this is the dopamine or dopaminergic neuron D1, D2, D3, D4 and D5. These are the subtypes of the dopamine receptor. So it has to go and bind with the particular receptor to exert its action. This is the normal mechanism. So, but in Parkinson, you are having reduced or decreased level of dopamine. So, this is the coming to the drugs exact mechanism. So, when we are giving the levodopa alone, okay. So first, think about when you are giving levodopa alone. It is getting metabolized by dopa decarboxylase, same metabolizing enzyme. So peripherally, it is converted into the dopamine, dopamine, and it is producing undesirable ADR side effects. And it is producing undesirable side effects or unwanted adverse drug reaction like nausea, vomiting when you are giving this drug alone. But normally, or the common prescription you will be having or the current dosage for Parkinson patient is combination therapy, or it is given always in combination, levodopa and carbidopa. So this combination is prescribed. Okay. So when you are giving this combination, it is preventing the peripheral metabolism, tissue metabolism. Carbidopa inhibits the dopa decarboxylase enzyme. So negative symbol you have to put. So it reduces the peripheral tissue metabolism both in the that is in the tissues, and also it reduces the metabolism in the GIT. So you will be having the increased concentration of the drug levodopa peripherally. So you will be having after kinetics the drug reaches or it crosses, that is it is not getting metabolized by the enzyme, so it is entering into the central nervous system. Most of the drugs in the neurons, that is, or in the central nervous system, it is getting metabolized by the respective enzymes. Then it is converted into, that is, dopa to dopamine. So it increases the level of dopamine in the neurons in this manner. This is the exact mechanism of levodopa and carbidopa. Coming to the drug classification, the first category is drugs affecting dopaminergic system, because the main neurotransmitter is involved is dopamine. So under this you are having, first one is dopamine precursor. Dopamine precursor is nothing but these are the drugs which increases the formation or synthesis of dopamine precursor. Okay, so levodopa or L-dopa plus carbidopa. Okay, so already I have explained levodopa and carbidopa, and the dose is 25 mg of carbidopa plus 200 mg of levodopa, 2 to 3 times a day depending upon the patient. Either it is 2 times or 3 times depending upon the severity of the symptoms. The second category, which is belonging to the dopamine drug affecting dopaminergic system, is dopamine agonist. You know what is meant by agonist? Agonist is nothing but it is producing the action similar to that of the dopamine neurotransmitter. So bromocriptine and pramipexole, these are the two drugs, important drugs, which is coming under dopamine agonist. So the dose of bromocriptine is 3.75 to 4 mg, that is daily, either 2 to 3 times depending upon the severity of the symptoms. Pramipexole, and the dose of pramipexole is 1.5 to 4.5 mg per day, that is daily. Okay. The third one is peripheral decarboxylase inhibitor. Decarboxylase enzyme inhibitor, and the name of the drug is carbidopa, 200 mg. Next is benzarazide. Okay. The fourth one is MAOB inhibitor, monoamino oxidase B inhibitor, and the drug is seleginide. Seleginide dose is 10 mg per day. COMT inhibitor. The fifth category is COMT inhibitors, and the drug is entacapone, chalcapone. Entacapone, the dose is 600 to 2000 mg per day, 2 to 3 times depending upon the severity of the patients. Chalcapone, 200 to 600 mg per day, and the dose is also 2 to 3 times depending upon the severity. Mechanism. Levodopa. Levodopa is a prodrug. It is always given in combination with carbidopa. So second point, after biotransformation by dopa decarboxylase, it is converted to dopamine, which is transported actively across the blood-brain barrier. The third one, the drug must be administered in combination with carbidopa. And the dose, everything we have seen in the drug classification, because it is inhibiting the peripheral metabolism of levodopa by dopa decarboxylase enzyme. Thereby, it is increasing its concentration, that is the drug concentration in the central nervous system. In the central nervous system, that is in the substantia nigra, it is converted into the dopamine. Okay, so thereby you are enhancing or increasing the level of dopamine in the central nervous system. If it is getting metabolized peripherally, the unwanted side effects like nausea, vomiting, and the main area is cardiac arrhythmias and hypotension will occur. So this is the main mechanism of action of levodopa. It is always given in combination with carbidopa. Coming to the pharmacological actions. First one is CNS, Central Nervous System. In the central nervous system, D1 and D2 receptors are involved in the therapeutic response of levodopa. So when the receptors are getting activated, there is a reduction in muscular tone or rigidity, because the drug is acting on the dopaminergic pathway in corpus striatum, so which is controlling the muscular tone and rigidity. So there is a reduction in muscular tone and rigidity. Then third one is frank psychosis may occur. Okay. This is the important viva question. Frank psychosis may occur. The secondary symptoms or secondary manifestation like gait, posture, speech, altered speech, and facial expression are gradually normalized. It's also important pharmacological actions of levodopa. Then it causes tachycardia. Tachycardia means increase in heart rate. The last one is the postural hypotension. There is a reduction in blood pressure, which is due to the concentration or the presence of dopamine in the central nervous system by acting on the, that is, sympathetic adrenergic receptors. The next is pharmacological action is the drug is acting, that is, on the cardiovascular system. So CVS. The peripheral dopamine which is present or circulated in the blood, it is causing or it causes tachycardia. Tachycardia, increasing heart rate, and postural hypotension. So in the central nervous system and in the cardiovascular system, you will be having postural hypotension may occurs due to central action system. So in the central nervous system and cardiovascular system, you will be having the similar points which is described. The third one is CTZ. CTZ is nothing but chemoreceptor trigger zone. So dopamine stimulates CTZ zone and it produces nausea, vomiting, and other ADR, adverse drug reaction. The last one is endocrine system. It increases growth hormone release and it also reduces the prolactin release. So these are the important pharmacological actions of the L-DOPA.